and he got a lot of awards, and also legend of homeopathy from Telangana. Now I would like to call upon to the dais Dr. V. Narsimha Garu, Associate Professor, PG Department of Dravyaguna, Dr. BRKR Government Ayurvedic College. 15 years of teaching experience and 10 to 15 dissertations and 10 publications. And he is very active in the government Ayush health sector as a nodal officer, and he attended as a guest session. Professor Dr. S. Praveen Kumar Garu, myself Dr. Krishna Nayak, I am the session coordinator for this and founder and director of Sri Samskriti Ayurveda, where now I would like to briefly introducing about the guidelines of the guidelines to the presenters. As the time of the sorry for this session, the keynote has been delayed, so now the time for the presenters has been extended to 12 to 15 minutes, and for each presenter there will be 10 to 15 minutes, and the assessment criteria will be assessed by the chair, co-chair as well as the coordinator. So the best paper award will be given in the valedictory program, and the assessment criteria chart, in the assessment criteria chart, timely completion of the consideration of the points in assessment chart is timely completion of the presentation, scientific relevance of the topic, scientific methodology, clarity of presentation, elements of new knowledge. So now I would like to call presenters on the dais. Professor Priya Vittal Patil to present her topic, homeopathic approach to managing a case of breast fibroedema evidence-based study.
Priya Vittal Patil, HOD Professor, Department of Surgery, MNR Homeopathic Medical College, Sangareddy. Good afternoon, respected sir. Good afternoon, all students. My topic for today's presentation, homeopathic approach of managing a case of a breast fibroadenoma, a evidence-based study. Nowadays, fibroadenoma are very common, and main for the decades of the ages, the surgery is the main approach for treating a benign as well as a malignant tumors. But nowadays, increasing in the eras, fibroadenoma can be treated with a conservative line of a treatment also, because fibroadenoma, it is very common in the young females around the age of 15 to 13 years, and very commonly seen. Basically, the hormonal disturbances or increase in the progesterone levels are a cause for a benign fibroadenomas. Now, today's case is a 19-year female patient who came with me a lump in the right breast and having a pain in the right extremities. Pain started and patient suddenly diagnosed with a lump in the right breast, and patient is very anxious regarding that tumor and very doing. They are advised for a surgery for a routine line of a treatment. They came for me as a treatment. Next. The purpose of the study is to find the efficacy of the homeopathic remedy in a benign based fibroadenoma and illustrate the importance of the evidence based case study. The case study dated 9/10/2021. A presenting complaint was a lump in the right breast, notice stress, that is a pain in the right extremity, pulsating pain, descend downwards to hand. After this, the patient noticed the lump in the right breast. Pain aggravated before and during menses is the main chief complaint. before treatment investigations were done, which was showing a fibroadenoma size 3.2 into 1.8 into 2.6 centimeter. FNSC is also done for routine investigation, which is a negative for malignancy and suggestive of a benign nature of a tumor. Case was repertorized using a complete repertory and BBCR, where conium came for a fourth pace at birth, the conium covering a mental as well as the physical aspect of the cases. Both the mental aspect is also covered by where a mind, grief, silent, pent up gives a 3-mark remedy. Other symptoms which is taken as from a complete repertory, it is common for a benign based fibroadenoma, but concomitant which is covering in a BBCR, that is a before and during menses aggravations are covered in the BBCR repertory. First prescription was given in conium 201 dose globules and follow up after 1 month. Follow up were considered during a 1 year of a period, and patient feels better after giving a conium. Patient, those who feels no change in the size of a lump, but patient feels mentally and physically well. Patient, those who does not want to mix with the other people, after giving a remedy, patient feels better and wants to go outside without mother and brother. Patient is gone now, is free to go outside also and free to talk with the people also, which is she stopped after the father's death. After FNSC, where the patient diagnosed with a benign nature of the tumor, again second learning aspect is the aphorism number 97, where the immense patient was given while treating the cases and giving a treatment according to the improvement of the patient. That is also the another learning aspect. Here the patient's improvement in mental as well as the physical complaints gives you the patient's assurance regarding a disease condition also, and majority of the time the conventional treatment, if you are not supporting, if you are giving a home cases as well as, because the patient usually having a fear regarding a cars after operation, which is get a unmarried women also. So this is my learning aspect from these cases. We have to anxiety regarding the investigations and result after investigations are also important. Thank you so much. Subjective as well as objective symptom. Case was very clear cut regarding a fibroadenoma. Here investigations gives the reduce the anxiety of the tumors with patient side, sir. After examination we have a clear cut idea that this is a benign based fibroadenoma only. Investigation supported that it is a benign in nature, tumor is benign in nature.
Subjective and objective parameters.
Here, sir. Yes, sir. Reports are there, sir. Reports are there. Before treatment and after treatment reports are there. Patient, we have to give a gradation of the cancer or stages of the cancer. We can usually get by investigations or MRI reports. That is, we can consider as an exclusion or inclusion criteria in the malignant patients, sir. Here I considered a report of UHG, FNSC reports are mainly taken into the consideration.
Hospital. And for this session, keynote, especially keynote, వినిపించట్లేదా? Dr. S. Praveen Kumar sir. He is a retired principal and HOD of Department of Medicine, JSPS Government Homeopathic Medical College, Ramantapur, Hyderabad, and member of SFC and Government Council, National Institute of Homeopathy, Kolkata, member and expert committee of Ayush Department, Telangana.
Hello, dear friends. Chairperson, co-chair, moderator, my friends, students, interns, PG students, ladies and gentlemen. At the very outset, I apologize for coming late. Just like in Kolkata, when the person reaches office by 11 o'clock, if the HOD were to ask him, why did you come late? I started at 9. What to do? There is a lot of traffic block. That is the reason why I reached at 11. So my question is, my situation was also same. Usually it takes half an hour for travel from my house to this place, but today it took 1 hour. Anyway, it's not an excuse. Anyway, this is what you are in now. And today we will talk about, for most of you, I don't need to make you understand. But I was told there would be a conglomeration of audience from various systems of therapeutics. Now, the basic factor when we talk about a system, illnesses under the sun, every system has got its own scope and its own limitations. It is up to us, the physicians in that particular system, to understand what is our scope and what is our limitation. If we don't know the scope, most of the times we would tell the patient, I can't treat it. And when we don't know the limitations, probably we might take up even the worst cases and kill the patients in our clinic itself. So both are dangerous. It applies to every system. To a greater extent, I am not praising allopathy, but to a greater extent, allopathic doctors know what is their limitation. And they also know what is their scope. But because of the different situations, being in a corporate hospital or being target oriented, they might take up the cases, but they would definitely tell, it is not my case and I can't do this. So they would tell. But most of the times we would tell, we will do it. Maybe overconfidence, maybe not understanding the scope and limitations. So now I would like to share at a faster pace 4 cases of different varieties in JSPS. And he was having convulsions, especially on the right side. And he had aura of blurred vision. It was diagnosed to be a tuberculoma of brain when he went to the nearby physician. And you know very well about tuberculoma. Most of the times it mimics like malignancy and it has to be evaluated properly. So again he got seizures and he was evaluated at a corporate hospital, and again they found it to be the same diagnosis, tuberculoma. Past history, underwent appendicectomy. Then his personal history, nothing great significant except desire for spicy food and eggs, thirstless. Bedwetting was also mentioned. Now, as a person, he was a stubborn child. We have a greater advantage in the college when we are working, like our friend Krishnamurthy is there. A lot of PGs would be there. They would take case very meticulously, very seriously, which probably given to us, we wouldn't have done that job. So they have done all the great work. And he does not obey parents' words most of the times. Mind well, the age 13, teenage. That's the commonest psychological phenomena. Teenage, usually they resist. I don't. That is what it comes. He has fear of being alone and darkness, especially while sleeping. Now the granulomatous lesion, tuberculoma, which was diagnosed. Ring enhancing lesion, that's what its pathological description. Then they have done the repertorization, taking all the rubrics. You can see there causticum, sulfur, belladonna, pulsatilla and all that. So obviously we would select causticum, but we did little more work. Now, Kent writes in his repertory introduction, if the drug does not cover the pathology, it may not cure the case. So, does it cover the pathology? To confirm that, there is only one drug in Robin Murphy, tubercles in brain, causticum only. So, obviously, we have given causticum in our ward there. We have given causticum from 0/1. We rose it to 0/3, 6 in his next visits. But we admitted him for 4 days or so. There was a lot of improvement. We discharged him and we treated him at his OP condition. There was no abnormality. January MRI report showed tuberculoma, and June there was no tuberculoma. Not only he was completely all right symptom wise, but pathology has also been completely resolved. This mild diffuse fatty liver. He was an alcoholic. Metabolic encephalopathy. If we see his history there, he is the father-in-law of a very VVIP in our state here. And he enjoyed very well. And usually what we do, even if a person at a higher level is not your relative, you will say, my uncle, my cousin, my friend. Likewise, Modi uncle, Shah cousin, like that. So people would tell that just to get mileage out of it. But here it is not. His own son-in-law is very highly placed. I can't take his name. So he used to love company. Now he is not enjoying. Wants to be all alone now. He is to enjoy. And does not want to meet anybody, and is farm out. Okay. Now, we have taken the rubrics. These are all the rubrics. Aversion to company, constipation, sleep disturbed, appetite diminished, aversion to meat, all these things which were taken as a case taking procedure. And then the repertorization was done. Pulsatilla, sulfur, sepia, natramore. Now, should we give pulsatilla or sulfur or sepia? There is something beyond this and behind this. It's not just simple. What he told, he doesn't like anybody, he is staying in farmhouse. All these things, probably he is trying to cover up something. That's what we need to. This is one such case, what I just wanted to tell you, that apparently whatever it looks in a patient is not sufficient. We need to go deeper if you suspect. So homeopathic doctor should be like a policeman. We should suspect everybody. So I said, I'll give you 4 different varieties of cases which are being treated at large at everybody's clinic, in the hospitals, in the clinics, everywhere. So write UVJ calculus. We have given sarsaparilla. It was UVJ calculus with mild obstructive hydroureteronephrosis. After sarsaparilla, it became normal. It's easy. Most of us would have done hundreds of times, maybe berberis, maybe sarsaparilla, maybe hydrangea, maybe lycopodium, calcarea, so many drugs, medorinum, all these drugs, osimum. Depending on the available data, we will prescribe the remedy. The 4th case, a young boy, 21 years, he was married 1 year ago. This is another case which needs a very great understanding, and you need to spend a little time again and understand what is happening and what keynote symptom you should search for. It is not the bunch of symptoms which are seen in a patient. We need to collect that very critical, characteristic, important feature in that patient which would help you to go for it. Okay, this is cross talk. Okay. Now, slowly developed depression because of his non-performance, erectile dysfunction. Within the shortest time after his marriage, he developed erectile dysfunction. You can imagine, seduced, and he had sex with his sister. Incest, we call it as. From that time onwards, he had several times sex with his own sister. She forced her. He had, this fellow is coming alone without his sister. So whatever he says may not have exact validity. It may be he himself doing all that, we don't know. But later we would understand. Now there is a conflict in his mind, according to him, that he is doing something wrong. He shouldn't have indulged in this type of affair with his own sister. And this is causing all the problem. So there is a conflict. Most of the times the conflict causes the problem. In Harrison's Internal Medicine, you can read under syphilis, the edition what I read. Now don't challenge me with your latest edition if it is not there. But what he says, as an experiment, they have sent 100 men to a same prostitute, one after the other, one day after the other, who was confirmed to be having Treponema pallida infection. And only 75 people got the infection, 25 did not get it. And this repatriation, we have given the medicines like Agnus castus to start with before we could come to repertorial result. We continued medorinum tenem as an intercurrent. Common practice what we have been doing. And later lycopodium came up in the repertorial chart, so we thought it would be the remedy. We gave lycopodium. We should have given 0/1, but we gave tenem to see results. But one thing which was very prominent, ailments from secret wise, it is there in your repertory. He has been indulging. Once if it has been done, it does not mean that you should repeat the same mistake again and again and again. If he were to be conscientious and neat and correct person, he would have avoided it. But he has been indulging. So there is that type of element. So basing on this, and we all know the selenium's action on erectile dysfunction. When it was given, he was completely corrected. So now we have our college JSPS has got specialty clinic as well. More than 53,000 patients are being registered there every day, Monday to Saturday. HIV cases are being treated there. I too have thousands of cases in my clinic. So these different cases, lot of improvement. It is a little premature to declare all those results, but I'll just give few glimpses of the reports. Now he is happy. I have the recording. I don't play it now. So he was happy because he became negative. Then this is one seronegative. You can see here. This is another Western blot negative. This is what seronegative. This is another case where CD4 improved and it is seronegative there. So likewise, now what we have seen there, different types of cases. How do we treat it? Homeopathically, of course, Hahnemann guided us with classification of diseases and we can definitely treat according to that. So, har dafa jinda tilasmat kaam nahi karega. We have to see whether it is acute or indisposition or chronic or miasmatic, non-miasmatic. What is it? Depending on that, we can select a case. So, after that type of exposition, I feel we'll just scan through the homeopathic history in the world and in India. You all know similia, similibus, and then science of healing. There are so many cardinal principles which are very important, seven cardinal principles basing on which homeopathy is being practiced. Knowingly or unknowingly, you have to follow this to get a correct result. You may not remember at that time, but you would definitely use the principle there. Then of course, in India, second highest. It is growing very faster, much faster than any other system. The pace at which it is growing, like Indian economy, 26.3% in the past year. And it is doubled, 26,000 crores. Now it is its market in the country. And there are regulations, National Commission of Homeopathy. It was corrected, okay. Then CCRH controls the research. And if it is AC Nielsen survey, 62% of current homeopathy users would never like to use any other system. Now, worldwide, if you just scan through 200 million people, 100 million people in India, recent survey says they use homeopathy, and 200 million people in the world across, they use homeopathy. It is second most used medical system with over $1 billion in expenditures for such therapy. It has been mentioned that the market size in 2020 is 6.2 billion US dollars, and they predicted by 23 this year it would reach around 20 billion dollars. So that is its market, and so much of 100 member countries. And if you see America, it is not still a fully recognized system, but some states have recognized, some states need to have different courses and all that. And research is governed by CCRH. Homeopathic education is going on in many countries, including South Africa as well. Thank you very much for this Swasthya Expo, and all of you for your patient hearing. If you have any questions, I would welcome. Thank you very much.
Thank you, sir. We feel very privileged to have you on this particular platform, and it was wonderful, sir, that you have elaborated point to point with case wise. And now I would like to call next presenter. Next presenter, Lehya Reddy.
And my colleagues and audience, myself B. Lekya Reddy from Dr. B.R.K.R. Ayurveda Government Ayurvedic College, Department of Samhita and Siddhanta, Hyderabad. And my topic is on the lifestyle disorders and non-communicable diseases in Ayurvedic perspective. Diseases which are not transmissible from one person to another person. These are the diseases which are result in the environmental, behavioral and lifestyle changes. The major NCDs are heart diseases and stroke, diabetes, cancer, chronic lung diseases and other NCDs which include obesity, etc. The major risk factors are physical inactivity, alcohol abuse, unhealthy diet, tobacco. I have taken this survey from WHO report in 2019. According to this, 86% of deaths from NCDs occur in low and middle income countries. That too in India it is about 66 cases, and while coming to the worldwide it is about 17.9 million deaths. 9.20 lakhs deaths due to cancer in India. When it comes to the worldwide, it is about 9.1 million deaths. 11.46 deaths due to chronic respiratory diseases in India, whereas in the worldwide it is about 4.1 million deaths. 3.49 lakh deaths due to diabetes in India, while in worldwide it is about 1.5 million deaths. About 80% of the premature deaths occurs due to these NCDs. Risk factors of NCDs and their effect on the body. Each risk factor can cause two or more non-communicable diseases, and they are interconnected to each other. Coming to the tobacco, excessive users of tobacco will lead to the heart attack by increasing the respiration and heart rate, and chronic bronchitis due to cilia damage, emphysema because the sacs becomes less elastic. It leads to the lung cancer because it obstructs the passages. CHD and stroke due to the constriction of the blood vessels. Same as well in the unhealthy diet. Short term includes bloating, sugar crash. Long term includes obesity and type 2 diabetes. CHD and stroke due to the blockage of the blood vessels. Unhealthy diet examples are soda, sweets, energy drinks. Physical inactivity. Physical inactivity leads to increased triglycerides and decrease in the activity of lipoprotein lipase that leads to the heart attack. Prolonged sitting leads to colorectal cancer, prostate cancer. And there is also metabolic dysfunction such as hyperglycemia, hyperinsulinemia. Hormonal imbalance. Stress increases the blood glucose level, blood pressure, sleep problems, and depression. Consumption of alcohol leads to the inflammation of pancreas and liver that leads to the diabetes. In the circulatory system, it leads to the heart attack by increase in BP. There will be rise in risk of cancer in colon, liver, esophagus, breast cancer. I have correlated the causes of modern in these three categories as per Ayurveda. First comes to the Aharaja Nidana. Atisnigdha Ahara leads to Damani Upalepa, Viruddhahara, Vishamashana, Madhyati Sevana. Viharaja Nidana is Divasvapna, Avyayama, Vegadharana. Mansika Nidana, Chinta, Krodha, Isha, Baya, Shoka. Finally, this all Nidana leads to the Vata Prakopa, Srota Varoda, Agni Vaishamya, Dosha Sanchaya. I would like to present another condition is that in Kapha Nanatmaja Vikaras, there will be Hridaya Palepa, Damani Pratichaya and Atistaulya. Modern causes in relation to Srotas. Here are the causes regarding to the Srotas of Mamsa, Medo and Rasavaha. I have enlisted the same Nidana causes according to the modern in the left side. Coming to the Mamsavaha Srota Dushti Lakshanas, Abhishandini Bojani Stula Nicha Guru Nicha, Mamsavahini Dushyanti Bhuktvacha Swapatam Diva. Coming to the Pradoshacha Vikaras, Mamsavaha Pradoshacha Vikaras is Arbuda and Adimamsa that we can be related to the cancer. Coming to the Medovaha, it leads to the Astav Ninditiya and Prameha Purvarupani, which can be correlated with the obesity and diabetes. And coming to the Rasavaha, the Pradoshacha Vikara is Sroto Avaroda, which can be related to the cardiac diseases and stroke because there will be thinning of the blood vessels. Results, first I would like to explain the Swasthya definition. Samadosha, Samagnisya, Samadhatu, Malakriyaha, Prasannatmendriya, Manaha, Swasthya Ityabhidhiyate. Here comes to the features of a healthy person. Hitahara Vihara Sevi Samikshakari, Vishadacha Buddhihi, Gnanam Tapa Tatparata. These are some of the features of the healthy person. Prevention and management. Coming to the Ayurveda, Swasthasya Swasa Rakshana, Aturasya Vikara Prashamna. Ayurveda is the foremost science to explain the prevention of the diseases, so that I kept more focus on the prevention than management. Coming to the self-care, Nidana Parivarjana. Nidana, according to Ayurveda, there are mainly three types of Nidana which causes any diseases. They are Prajnaparada, Asatmendriyartha Samyoga, Kala Parinama. Prajnaparada play an important role in the causation of the NCDs. That is, Prajnaparada is, even though we know that some activities will cause a disease, we do that. That is nothing but Prajnaparada. Di Dhruti Smruti Vibramsha. Again, coming to the Asatmendriyartha Samyoga. Asatmendriyartha Samyoga, Ati Yoga of the Rasanendriya. That is excessive usage of tobacco and excessive usage of alcohol. Next, coming to the Padanshika Krama, it is habituating to the healthy regimen and withdrawal to the unhealthy regimen. It comes under the Padanshika Krama. Agni Palana. Jatra Agni plays a main role in the digestion of the food. Bhava Prakasha gave 4 divisions of the abdomen while eating the food. That is, 2 parts for the solids and 1 part is for the liquid and 1 part is for the Vata. Again, he also given the tip that taking of lavana and adraka act as a appetizer before the food. Na Vegadharana. Coming to the Pranavaha Srota Dushti Karana, Vegadharana is the main cause for the disease. So that coming to the Lakshanas of the Pranavaha Srota Dushti, Alpa, Sarshula, Baddhata, Uchvasa are there in the Pranavaha Srota Dushti Lakshana, so that Vegadharana should not be done to maintain healthy. Dinacharya. In Dinacharya, Snana, Nasya, Abhyanga, Vyayama plays an important role in the prevention of the NCDs. Nasya is Shiras, Tila, Kapalanam, Snayu Kandaraha, Adhika Balam. Next, Snana is Snanam Ojas Karam Param. Vyayama is Lagavam, Stairya Karam, Doshakshaya, Agni Vruddhischa. Trayopastamba includes Ahara, Brahmacharya, Swapna, Ahara, Brahmacharya. If these are in the equilibrium state, it does not cause any disease. There in the quotation we can see that Bala Varnopachaya Yavadayu. It will be continuation throughout the life. Coming to the Ritucharya, there will be Shodhana procedures of evacuating the Kapha, Vata and Pitta in the seasons Vasanta, Varsha and Sharad respectively. Vegadharana, in Vegadharana, 13 types of Vegadharana are there. Hridroga is caused due to Shramashwasa and Bashpa. Panchakarma, any disease which is cured with Panchakarma is never relapsed again because it is eradicated deep from its roots. Nutrition. One should keep in mind about these things when we are taking the food. That is Prakriti Karana Samyoga Rashi Desha Kala Upayoga Samstha Upayogda. Nitya Sevaniya Dravyas. These are the dravyas which can be used regularly for the prevention of the NCDs because they give the essential requirement nutrients for the person. They are Shashikashali, Eva, Mugda, Jangal Mamsa, Amlaka, Saindava, Antariksha Jala, Kshira, Sarpi. Rasayanas, Edzara Vyadi Nashanam, Tad Rasayanam, Lavopahi Shastanam, Rasadinam, Rasayanam. Some of the Rasayanas for the diabetes, Medo Roga and hypertension, asthma I have encoded these drugs. Rituharitaki, this is the in Bhava Prakasha, Rituharitaki can be used as Rasayana when we taken along with other different Anupanas in different Ritus. Viruddhahara, all the food we take now is Viruddhahara, which is a leading cause for the NCDs. Some of the Viruddhahara are Virya, eating ice creams, that is nothing but brownie. Samskara is potato chips and Kala is ice cream in winter season. Samyoga is fruit salad, milk with banana. Dosha is Kapha Prakriti person eating ice creams. Kosta is consumption of the sprouted pulses by laborers, workers. And Satmya is veg person eating egg containing cake. Yoga and Pranayama. Yoga plays an important role in the prevention of the diseases, particularly NCDs, not only the NCDs but all the diseases. Especially Surya Namaskara is itself enough for prevention of the diseases. And coming to the Pranayama, Pranayama plays an important role in the prevention of the diseases and in stress related diseases, particularly in the IT employees. Particularly in Pranayama, Aloma, Viloma Pranayama and Brahmari, Basrika can be done. And Acharya Rasana, these are the behavioral changes to maintain the healthy. Some of them are Akroda, Madhya Maithuna Nivrutti, Dana Nitya Tapasvinam, Anayasam Nitya Anrashaya Paranam, Sama Jagarana Swapnam, Nitya Kshira Gruta Ashinam, Dharma Shastra Param, Vidyanaram, respect seniors and Astikas. And conclusion is that take a moment for yourself to be healthy and you can choose the one thing what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day. Thank you.
So open discussion for all. Any questions?
No sir. Particularly
Can you justify?
Oh, yes sir.
Tell me.
Particularly, I have taken all the major non-communicable diseases and its prevention in Ayurvedic perspective, sir. Not the one thing.
Not diabetic and cancer.
No, sir.
Okay, thank you.
Thank you, sir.
Recognize the importance of Ayurveda, yoga and naturopathy, Unani, Siddha and Sovarikpa, homeopathy and other traditional wellness practices in achieving overall well-being. With this in mind, we embarked on a mission to create a platform that would bring together experts, practitioners.
Myself, Dr. Jayaprada. I have done my BMS from BRKR College in the year 2004, passed out, and my Masters in Kriya Sharira from MUHS. I have done my PG Diploma in Yoga out of interest from Gulbarga University and Diploma in Skin Aesthetics. Along with this, I have done many of the workshops. So my topic for today is effect of meditation in cancer. It is a case review study. Whatever I have seen in the patient, I have just put it. Effect of meditation. Here, I would like to tell that the patient is about 77 years of age and she has sustained 11 chemotherapies and 2 months of radiation therapy at the age of 77. So is it possible? Just doctors had told that she may survive hardly for 3 to 6 months, but along with the chemotherapy, with the supportive therapy like meditation, she had survived for 1.5 years. So I felt that there is an effect of meditation in sustaining the chemotherapy. So the main purpose of this article is to provide the information that how well the meditation helped in improving the willpower and enhance the positive thinking in sustaining the chemotherapy and radiation in the cancer patient. It is acted as a supportive therapy in relation to the chemotherapy. Purpose of this introduction. So here meditation is one among the Ashtanga yogas. What is yoga? As we all know, yoga is nothing but it has come from the term yuj, that means union or unite. So what is the union? Union of your soul with the a thought or a music, and making yourself emotionally calm and stable state. So Ayurveda believes a person to be healthy when there is equilibrium both in body and mind. So we believe that as per Ayurveda, if mind is affected, that is mana is affected, it will have a mutual impact on the body also. And even if the body is affected, it will have its impact on the mana. So we give importance, let it be any disease, you have to give equal importance both to the mind as well as the body. You should not focus only on the body if it is a physical disease, and that means you have to give importance even to your mind in treating any of the disease. So owing to importance of mind, in Ayurveda had explained the Sattvavajaya Chikitsa, in which meditation plays a major role. So our topic is cancer. So nowadays we hear everywhere about the cancer. What is this cancer? It is nothing but the abnormal cell growth. So if we see these abnormal cell growths is rampantly increasing in other parts of the body. It is spreading into other parts of the body. But going into the details, as just now one of the speaker had explained what are the causative factors, like Alekya Reddy, she had given you different causative factors which are the exogenous and the endogenous factors. Exogenous being like pollution, everything. So in situ factors. What are the in situ or the endogenous factors that can be considered for the cause of the cancer? No one is exactly aware why this cancer is occurring. So a theory of free radicals is there. Free radicals are nothing but the electrons, atom or a molecule which is having a free electron around it. So when these free radicals are increasing in your body, so that should be normally in physiological status, in the homeostatic status, these are counteracted by the antioxidants in our body. So may be one of the cause for the cancer. So this is one of the theory. So to counteract this free radicals, antioxidants we will provide. So what are these antioxidants? How meditation helps in antioxidants, we'll see in the future further study. So impact of cancer when a person faces the cancer, physically he will be disturbed, along with that mentally, emotionally, and even he loses the social connectivity also. This is the impact of the cancer in a person. So my topic is lung adenocarcinoma case. So lung cancers, usually among all cases of cancers, it is around 6.9%. Among these 6.9% of lung cancers, lung adenocarcinoma comprises of 40% of the cases. So this lung adenocarcinoma is nothing but the subtype of a non-small cell lung cancer, which involves, especially in women. We see this type of cancer, especially in women, above the age of 71 years and is very rare under the age of 20. So my case history, here the age of the patient is 77 years, female. By occupation, the patient is a gynecologist, a doctor. A chief complaint was breathlessness since 6 months, cough since 3 months, left-sided chest pain since 1 week, and she has got no history of comorbidities, diabetes or hypertension. And personal history, she herself used to meditate almost since 16 years, and per day she used to spend for the meditation almost around 15 to 16 hours a day. So diet is purely vegetarian diet. So based upon the investigation, we came to know in the CT scan there was the collapse of entire lung, left-sided lung, because of the lesion in the left main bronchus, and there was a minimal pleural effusion. And when the pleural tapping was done and pleural effusion was sent to the pleural fluid cytology, it has been investigated as the adenocarcinoma by a cell block culture. So neurologically. So this was her condition. Her energy levels were never less. She used to swing. She used to just, if she wanted to wear everything, whatever she wants. She used to enjoy her life to the extent, even though her condition was deteriorating. So my discussion upon this point is various studies had observed that meditation group had increased the levels of melatonin, anti-cancer properties, and immunomodulation and hematopoiesis, reduction of plasma cortisol, heightened phagocytic capacity of their blood monocytes and neutrophils, more readily activated T cells, rapid recovery of functional T cells, improvement in the NK cell cytolactic activity had been observed, release of endorphins, dopamine, and serotonin. Meditation has recently been explored as an effective pain control modality. So here I would like to focus few points upon the endorphins, dopamine, and the serotonin, melatonin levels, which are considered as the happy hormones, right? So what are these happy hormones? This can be taken as a further research studies by the youngsters or anyone who are willing, like comparing the meditation, the non-meditation groups. So melatonin, usually it is secreted by the pineal gland in the night during the sleep, and this will reduce the stress. This has got the oxidative effect. So it reduces the oxidative stress, whereby reduces the pain and induces the sleep. Once the sleep is induced, the patient's stress levels will be reduced, the pain will be reduced, and she will be active. And dopamine is also another, along with medical care, has helped our patients to overcome her side effects to the treatment and also improved her physical response, sustaining the adversity of the disease. We recommend larger group of studies. This I wanted to focus. We recommend larger group of studies comparing the cancer care with and without meditation, along with scientific markers to assess the mental well-being. This can be taken as the research-based study for further research in this topic, where you can take the markers like endorphins, dopamine, and serotonin for the further studies, comparing with the meditation group and the non-meditation group, along with the chemotherapies. Thank you. It may be
Focus is due to chemotherapy or meditation.
along with chemotherapy was there, sir. Meditation we kept it as a supportive therapy. Yeah, it's a supportive therapy. No, only with meditation we cannot. It is like meditation, the age lifespan had increased. Which one, sir? In meditation?
No, meditation. Which type of meditation you are adopted in the cases?
In this case, the person used to meditate more than 15 hours a day since 16 years. So maybe that might be having the effect to overcome, as she had been said that she may die within 5 months, but she had survived for 1.5 years. No, only meditation, mindfulness meditation, sir.
In your title?
Nothing but supportive therapy only.
It's a supportive therapy, sir, where you can extend your lifespan along with the chemotherapy.
Prolongs the patient.
Yeah.
Okay, thank you.
Thank you, sir.
Ramakrishnamachari. His topic is role of Carovita, a dietary supplement in improving general health in cancer conditions.
एवं respected chairperson, respected co-chair and organizers, Mr. Naik sir, and I thank to the organizers who have given an opportunity to talk before you, and I also thank the Olin and the award company which is preparing this nutraceuticals. Primarily, it is an informing presentation. As earlier in our session, in the main session, Dr. Nagaya sir told that the importance of the millets, what is the millet, etc. The reason for that, because nowadays we require the nutraceuticals to incorporate in our medical science. Ahara is mentioned in all systems, whether it is a homeopathy, whatever it may be. Aharam Parabrahma Sarupam. Without ahara, nothing will be happen. All the ahara process into the medicines. Aushadaya udbhavati. From where? Aushada. So that means the ahara is given very important in our science. In Tamil proverb, they say that Unave marundu, marinde unavu. That means medicine is a health, and health is medicine. Because without food, nobody survives. So there is my subject from these nutraceuticals are the health supplements for the targeting persons. How the nutraceuticals or the health supplements are prepared from the various components. Among that one, we have taken the which one the component? Either this one? Yeah. So I told you that we have taken the health supplements, particularly targeting people. In these particular cases, we have taken the cancer as one of the important conditions where we are facing the worldwide. Because there is no time to explain many things, so just I will shorten. Oh, this one, all right. So many people are getting the cancer and many people are recovered from the cancer because of the various factors, medicines, food, etc., etc. Why I am showing this one? Because we have to get the confidence on ourselves. How the cancer is affecting, but at the same time, because of the self-consciousness, we come over that problem. Many persons are come over from that problem, and I don't want to go to the details of this, how the cancer is produced because of the biochemical or the environmental factors or the many factors are there. Even the food factors. Nowadays, when you go for the various chemically prepared food are there, you are getting the cancer. So apart from that, taking the phenomena, for example, stop smoking to be stopped or taking the alcohol stopped, and at the same time, one more important is the food. Even though the percentage of the food is involved in the preventing the cancer because of the malnutrition also causes the cancer in some particular person. So that is why the food is also, poor diet is also one of the causative factor for the cancer. I don't want to go to all the cancer symptoms, etc., because my purpose is to give the food supplement in the cancer patients. We know that there are various cancers, adenomatous cancers, many cancers are there. That is why I am not going to give the details of each cancer or their symptoms, supplements, etc. But my concern is how the diet supplements will help in the many cancerous conditions. So this, because the cancer is causing the diet implements, for example, the malnutrition. Diet is making the full, particularly affecting on the system, particularly in the digestion and metabolism. So that is why the food materials or the dietary supplements are very important, either directly on the cancer subjects, and at the same time it will give the adjuvant therapy in the chemotherapy, radiation, immunotherapy, and various other therapies, conventional therapies. So this is one of the ideas that how you go to it. The Carovita is one of the dietary supplement I have taken for this subject. And among this one, we know that how the interventions are taken place, for example, medical, surgical, radiations, and among that, we have to support the patient with the various factors, for example, medical support and the dietary support. You give the family support, social support, many supports required the cancer patient. This is an idea how the cancer, or this may be taken as a general intervention for any disease. But among this one, the cancer patient, when you are taking various other things, for example, chemotherapy, surgery, the dietary supplement is important. That is why you are taken. And this is one of the products from the holding company. They are preparing this product by adding these millets and the pulses with botanicals. So that is the condition. And this may be again we tested for specifically for cancer purpose, because we are claiming yes it will help in the cancer, but where is the evidence? So that is why we have conducted in vitro that whether this powder will help in the cancer, is it compared with the other approved cancer drug. So they have selected that one ciprofloxacin, which has the anti-cancer effect, and they found with the comparative study with this powder, Carovita powder. Then they found that Carovita itself has nothing much effect on the cancer, but when you are adding with the ciprofloxacin, that is anti-cancer drug, that will synchronize that one, and they will help more effect on the cancers, and they reduce the cancer material. So that is why, as itself is not a medicine. I claim that it is not a medicine. I do not have an idea that I claim it is a medicine. It is not a medicine. It is only food supplement, and that will affect on your nutrition purpose. And at the same time, if you are having the another chemotherapy, that will enhance your chemotherapy effect. That is the reason that when you have taken this cystoplastin with the carovita, we have studied in one patient, and again we are going to study the same condition in the All India Institute of Medical Sciences in New Delhi. In the next month, we are going to have that studies in the randomized clinical trials, RTT, etc. So that is another matter. So here we have studied one patient which is having the cancerous problem, and as I already mentioned that this is not for the anti-cancer effect, but we have mentioned the clinical condition and health condition of the patient. So we have found that whether it is having any effect or not. Then we have given this drug according to the posology or the drug amount. Then we find that this is the case of a carcinoma patient. She is having the cholangiocarcinoma after the delivery, something like that, and she is taking the chemotherapy by the vincristine. We know very well that what is the vincristine, and she was taking the vincristine medicine, as well as at the same time she is not taking the carovitamin previously. Then we advised her, because she gets very, weight loss, and she is not getting proper sleep, she is not getting a good appetite. Then we advise that you add this carovita with your routine things. Then she has taken and she has consumed for 40 days. Then we found that this is the general condition, how the condition is improved. So that is, if you say that, of course, we don't have all the parameters have been fulfilled. There are some parameters still we have to consider. Some parameters are put very well, but still some parameters are not completely cured. Maybe the condition of the cancer. But still, on the whole, we find that carovita, a dietary supplement, will help in the cancer patient when she is taking the chemotherapy or the radiation or the immunotherapy or whatever the therapy she is taking, or post-surgery also. So if you are adding this for the patient, that will help in the dietary nutrition problems. That will definitely rational how it will act. For example, taking the anti-cancerous drugs, particularly botanicals, we have the rationale of this one, or the conclusion we say that rationale. How to do the rationale of this product? How do you conclude this one? So we have taken this, it acts as the dietary supplement as well as the botanical, which include that, but will help in the cancerous patient, particularly in improving your general health. Of course, they also help in for example, the same patient has the HCG levels have been decreased. I did not produce here all the results, because that is not my concern. Whether the HCG results are come down, or that my concern is the health improvement. So that is why we brought this one, and we are proceeding further. This is the first step we are going to show you. Next meeting we show all the details from the AMs also. Thank you all of you. Thank you very much.
Sir, you are putting the Google.
Yes, yes.
Google is a diet supplementary or drug supplementary?
That is under comes in botanical.
No. Just why you are putting
that is
diet supplementary?
That is I am telling, this is not an Ayurvedic medicine. First point.
It is not Ayurveda.
It is not Ayurvedic medicine.
You are Ayurveda, you told.
No, I did not say anywhere it is Ayurvedic medicine. I say that it is a dietary supplement having the botanicals which have been approved from the Government of India, Ministry of Health. You understand? I didn't say it is Ayurvedic medicine. I didn't recognize it as Ayurvedic medicine. I never said it is Ayurvedic medicine.
No, it is Ayurveda, either modern, whatever exercise is also not properly. The dosage is also not properly. How the extra sir, one thing I am telling
you, please.
This is extra pharmacopoeial drug. When you are giving extra pharmacopoeial drug to the patient, first you give you decide the dose and toxicity. Without toxicological study, with the dosage study, how you are giving the clinical study? Who will approve? No one can approve in India.
I understand that. That is
No,
why
sir,
we are
this type of
incorporating.
activities we won't support.
I never object you. I never object.
Respected chairpersons, delegates, and my dear friends. Myself, I'm Dr. Bindu Menon, integrative health practitioner. I'm basically an Ayurvedic doctor and have pursued my higher studies in psychology. and I have submitted my doctoral research work for PhD Psycho-Oncology from School of Medical Sciences, University of Hyderabad. Myself and my team members, that is Dr. Madhurya, Dr. Shramani, Dr. Sharad, we from cells divide uncontrollably and destroy body tissues. So I would like to explain how Ayurveda views this. Ayurveda understands cancer disease, which is known as Arbuda, with various definitions and descriptions, and it purely classifies this as a Tridosha disease, Tridosha Visheshan. And if we understand, as we all know, the cell, it is a structural, fundamental, the functional and the biological mechanisms in the living organisms. And here, from an Ayurvedic perspective, Vata, it controls all the cellular functions. Pitta, which can be more correlated with the, if Vata can be correlated with the nucleus in a cell, Pitta can be well-definedly correlated with mitochondria, because that is what provides energy and metabolism in a cell. And Kapha would be more appropriate to correlate with the cytoplasm, because it contains water, important organic, solubles and all that, and that gives the structural framework for the cell. So rightly, the Ayurvedic science also understands and defines cancer as a Tridosha Kopa. And if we look into the cancer statistics, that is actually increasing, the numbers are increasing in a very alarming rate. The Globocon estimates more than 19.6 million cases of cancer worldwide. And if we look into the spectrum of India, in India, cancer cases are increasing on an alarming rate. So when Indian system, the traditional complementary and alternative systems like Ayurveda, homeopathy and yogic methods, it has so much to do, contribute for this kind of a comprehensive cancer care, and that is the topic I have selected here. And when we look into the kind of, the conventional treatments, that is a modern oncology, definitely with a lot of developments, definitely the surgical manifestations, the minimal invasive surgeries, but the treatments like chemo and radiation, that leaves the patients with a lot of side effects. And when the focus is integrative, it is much more meaningful, because we are looking here how to reduce this drastic side effects and how to make the treatment more wholesome and how to improve the quality of life of cancer patients. The purpose of this also ahara, nutrition, the body-mind therapies, that is Sattvavajaya, and lifestyle modifications. This is very important, because when we understand cancer disease, there is a genetic or the hereditary aspect, also there is the environmental factor. So lifestyle modification is something very important. Minimizing the stress, improving the lifestyle is very important to improve the health and well-being of cancer patients. The design of the study uses a qualitative research method here, case study, to report the benefits of integrative cancer care in symptom management and improving general health and well-being of cancer patients, and in-depth analysis using methods such as interviews, observation, all the clinical records, and the patient feedback were documented for the study. I have followed a very proper case study approach, but because of the time constraints and the number of slides, I have limited it and put it in table form. So I begin with the first case study here. A 34-year male with complaints of giddiness, partial headache, nausea, loss of appetite had come to our clinic, and this was before 4 months. And he's doing very well now with the integrative approach. His MRI brain shows right superior frontal gyrus, and the biopsy shows astrocytoma grade 3. As we all know, astrocytoma grade 1 and 2 are like a mild case, very properly treatable and curable, whereas grade 3 actually presents a cluster of symptoms, and this patient had a very, very bad problem. From an Ayurvedic perspective, I have done Ashtavita Pariksha and Sattva Pariksha, and also certain clinical oncology standardized questionnaires like distress case were also included here. So the diagnosis is Vata Kapha Shirashula Chikitsa, and I've done Shamana Chikitsa here. Initially started with Patyaksha Datradi Kashayam, not going into the details here. Then the chemo-related gastric side effects were so bad that we had to initially focus on minimizing the side effects which is induced by chemo. So had to stabilize the gut, give some very pitta shamana medicines here, and then when the patient has considerably improved with the GIT complaints, gastritis and all, then the second prescription was added, which was Panchagavya Ghritam and all that. And also 2023, with these complaints, had a difficulty to walk, and there was a radiating pain right lumbar region with GIT problems, both constipation as well as gastritis, and had disturbed sleep also because of pain. So after doing the basic assessments and blood work, and also we have used a pain scale here, which is a numeric scale. We have given the basic sets of medicines, which is like Gulma Chikitsa, Vatanlumna Chikitsa here, and also Dhanvantara Kashayam. And the results were very amazing. The patient was on tramadol and aceclofenac injections and could stop the medicines within a month's time and is able to walk. Actually, I'm not able to post the videos of the patient here, but this patient has remarkably improved. The third case is female 65 diagnosed with CA cervix with diabetic complications. Here I want to emphasize the importance of the integrative approach here. This patient had a random blood sugar which was very high. I don't know, the patient had completed few cycles of chemo but had to discontinue because of various reasons. Very mismanaged diabetes. So first we had to focus on a proper diabetic care with Ayurvedic medicines, and there is an allopathic physician also in our clinic. Had to put on insulin first, which was very important because I don't claim we can treat every case with Ayurveda or alternative systems here. So this, I want to present this case as an integrative approach. So the blood sugar was stabilized, diabetic medication has continued because our RBS was 529. When it had come to a reasonable margin like 250, 260, we have focused more with the Ayurvedic diabetic medicines and other treatments. We understand Chaya, Pragopa, Prasara, Sthana, Samstraya, then Vyaktim and Bheda. So Prasara stage, if you look, the invasion where it is a very inflammatory condition and it has invaded lymph nodes and probably the surrounding tissues. And when we understand the going forward the complications or where it has invaded the surrounding tissues, organs, metastatic conditions, this can be defined under Sthana Samshram, Vyaktim and Bhedam with a lot of complications and advanced stage. Ayurvedic approach for cancer management that we have followed in our, from an Ayurvedic perspective is basically Shamna Chikitsa, because the Chodhana Chikitsa was, the patient condition was not very appropriate, because here if we understand the Roga Bala and Rogi Bala, the Rogi Bala is very avara. So we have started with Shamna Chikitsa, try to stabilize the gut, so Amapachana and Agni Vardhana, that was a systemic correction. So Agni and Shrotas is something that we have followed, and Ashtavidya Pariksha, Nadi, Jivha, Malam, Mutram, Dik, Sparshanam, Shabdam, Akriti gives us a lot of information. And then Mridu Shodhana, some of the medicines, it could be very simple medications but which has a mild cleansing effect. I think that helps in biopurifications. And coming to Bala, which is basically immunomodulated drugs, it could be as simple medicines like a Shatavari, it could be Ashwagandha, focusing on such. Also Brahma Rasayana, and even this has proven very beneficial for such patients. Sattva, enhancing the emotional well-being. That is how the patient understands their illness perception, psychoeducating the patient, giving them assurance and reassurance, and just not the patient but the family who are very, very worried, and giving them all kind of support. I think therapies like Yoga Nidra, which can be interpreted as guided imagery, I think it's very beautiful. All those series of discussions that we had from morning, like mantra, japa, yoga, everything, meditation, I think this all works well for a patient. The patient have reported a lot of benefit. The headache has reduced, no giddiness or sound intolerance. The Rasashaya Lakshanas and I have a considerably improvement is there. Improved stamina, he is able to do his day-to-day things. But what's not improved here is his little, that cognitive, some confusions remain. That is definitely because of being on a, but his quality of life has considerably improved here. Adenocarcinoma liver, as such, we know adenocarcinoma is not an aggressive cancer and it's very completely, manageable. So this patient has good relief with our simple medications like Visha, Tindugavadi and all that. His morphine was cut off completely. Cervix cancer with diabetes management, improved gut health and better diabetic control. Breast cancer, two of the cases we have focused more on their anxiety and distress management, along with giving supportive care to the family. So through these case studies, the study explains effective methods for symptom management in cancer with Ayurvedic medicines, Panchakarma, nutritious diet, guided imagery, etc. Ayurvedic immunomodulators, Rasayana, Sattva-Vachaya, that is a stress management, and deep relaxation methods proves to be beneficial in improving the immunity and reducing complications and recurrence of cancer, also improving quality of life. So although the biomedical treatment of cancer is considered important to reduce the progress of cancerous growth, the present study throws light on the integrative approach and its benefits in providing a holistic perspective to cancer. We are in tie-up with a lot of oncology specialized hospitals where people report a lot of side effects and had to and are not able to actually adhere to their ongoing cancer or radiation treatment, where we are focusing for a supportive cancer care, and this is helping a lot of patients. Implication of the study: integrative oncology is a novel method. It has larger implication to deliver effective management of cancer, and it combines conventional medicine. We are not stopping their ongoing chemo, radiation, or whatever is beneficial for the patient here on a first line of treatment, and we are combining Ayurveda, nutrition, psycho-oncology care along with other mind-body therapies. This helps to optimize health and well-being, thereby improving quality of life and quality of care. These are few references that I have tried to compile these cases and my presentation. Thank you very much. Open for discussion.
Open for discussion. Any questions? Any question?
Madam, one improved. What is assessment criteria?
Oh, you are
telling Ashtavida Parikshas, no?
Yes, sir.
Ashtavida Parikshas, how you classified
Yeah.
to conclude the drug is effect on cancer?
Yes, sir. I think it's a very relevant and relevant question here. But let me be very frank here. For the diagnostic purpose, Nadi, Jivha, Malam, Mutram, we have done that. And to see the patient improvement in terms of clinical, like I said initially, we are starting with Amapashna drug. So my understanding is Nadi, Jivha, also their gut gives a lot of information. So when we are giving some medicines, it's given for a set of weeks or 1 month. So definitely when the patient revisit our place.
Madam, all 8 tests are taken or only 1 or 2 tests are taken?
No, sir. Everything is taken, but based on the patient conditions, I think some set shows remarkable improvement.
No, when we are research,
Yes.
when we are research,
Yes.
should be pinpointed.
Yes, it should be pinpointed. You are right, sir, but I wanted to capture more information and I wanted to understand the case like stepwise, stage-wise, what is the patient condition. Like that's why I focus more on, I know it's a very elaborate thing, Nadi Ashtavida Pariksha, but every visit we have recorded this to see the improvement. But clinically, I'm an academician definitely, but I'm also focusing on clinical improvement for the patients here. So I can tell you like one of the case where the patient was not able to take anything. Their jivha had a lot of coating, like Ama Lakshanas were there. So when we had given some medicines, Amapashna, and after a month we see visibly that coating is not much there. So in that way I could relate the digestion has improved clinically from the patient feedback as well as from the
I'm not getting answer from you. Ashtavida, how many Parikshas Ashtavida means?
8.
8. Among the 8 you are taken, or among the 8, 1 or 2 you are taken for assessment criteria of that particular disease?
Yes, sir. My answer is For assessment criteria, I have taken all the Ashtavita Parishas because it gives me a comprehensive information about the patient condition. But now
Not criteria, diagnosis, not treatment criteria. Only patient condition.
Yes, sir.
Purpose you are
Patient,
taken.
you're right, sir. Patient assessment condition, I have included Ashtavita as one of the complete comprehensive assessment. You're-
After treatment also you can take, no?
yes, sir.
Before treatment, that
Before
is
treatment, I have done it regularly in all the visits, but I could elicit in some things like, case to case, I can say in this, these aspects have considerably improved. Am I able to connect with you?
You have presented most of the case studies only,
Yes, sir.
not focused on integrative approach or cancer. Are you agree or not?
It's an integrative approach,
Most of
sir.
the cases only case studies only there.
These are case studies, definitely.
Integrative approach is different from case studies now. You are not focused on it.
Definitely, our team has focused
Only
on that,
academically
sir.
you are focused only.
No, sir. Actually, clinically, how it happens is we have a comprehensive integrative consultation where there is on-board allopathic doctor, we Ayurvedic doctors are there. There is also nutritionists and physiotherapists. We plan like how generally in a typical multinational corporate hospitals you have a tumor board meeting. We have a live discussion here. We try to intervene accordingly stepwise. That's why I said that lymphedema case, Ayurvedic medications, like it was only more in inner medicines. It was more a manual lymphatic drainage, where the other case where the diabetic patient's random blood sugar was shooting up 526. I have not intervened there in the initial stage. So integrative here, I mean also, and few other two cases because I am a psycho-oncologist, I had a larger role to do. You have told me, you are telling me very clearly, I got your point, that I should do a pre and post assessment with some one or two things because it itself gives a lot of information to the patient. Thank you for that.
Right, ma'am. Right. Thank you. Thank you, presenters. Now it's time to announce the best paper. Out of 5 papers, 1 paper is got invalid.
We recognize the importance of Ayurveda, yoga and naturopathy, Unani,
They said to announce me. Dr. Jayaprada, best paper. And ma'am, you have to receive your memento on valedictory function. Okay. Rest of 4 presenters has to remain in the hall itself. They have to take your memento as well as certificate. Now it's time to felicitate our chair and co-chair. Now I request chair to felicitate the co-chair. HMAT, HMAT President Dr. Gopal Krishna sir to felicitate our chair. Sir, Gopal sir, and also hand over the mementos. Yeah, right.